Hello, my name is Dr. Jagdish Shinde, and I am working as a cancer specialist in Pune. Through my YouTube channel Cancer Care Pune, I am giving information regarding different types of cancers and its treatment. In my today's video, I am going to tell you information regarding proton beam therapy. So before starting this video, I will just request you to please subscribe to my channel so that you can get a notification of latest videos. So proton beam therapy is currently it's newer technology and a lot of people have a lot of enthusiasm regarding this latest technology of radiation therapy. So in my today's video, I am going to tell you about what is proton beam radiation therapy, in which patients proton beam therapy has to be given, what are side effects, and regarding cost, and which patients should opt for proton beam therapy. So starting from the basics, what is proton beam radiation therapy? Traditionally, before invention of the proton beam, we used to treat, and even today we are treating the all cancer patients with basically two types of machines. One is linear accelerator machine, which is called as LINAC, and second is a cobalt machine. So these are the basic two kinds of external beam radiation therapy machines which are used for treatment of cancer. In these machines, that is LINAC and cobalt machine, the beam used for treatment is called as either X-ray, gamma rays, or electrons. So basically these three types of beams are used in our traditional machines. So what is different with proton beam? In proton beam therapy, we use high energy protons as a beam of radiations. Ultimate target of all these beams is similar. It is a destruction of or damage of DNA of the cells, and thereby causing the cell death and uh, cure treatment of the cancer. But the physical properties of these different beams is different. Like the electron beam is specially used for treatment of superficial cancers, just like skin cancers. The photon beam or X-rays or gamma rays, these are the beams which are used for deep-seated tumors, like tumors which are located inside the body, and it has some kind of depth. So in these tumors, we use either X-rays or gamma rays. The problem with X-rays and gamma rays is that when radiation has to travel through the skin to reach a tumor which is located at particular depth. Suppose a tumor is located inside the lung, which is around 4 centimeter from the skin. So when we treat a tumor which is located at 4 centimeter inside our body, so in order to reach to that tumor, the beam, radiation beam, which is X-ray or gamma rays, it has to traverse from the skin to reach that tumor, and then after reaching that tumor, it will also exit through the tumor. So when we are treating any cancer with use of X-rays or gamma rays, the beam of radiation will travel from the skin to the tumor, and then it will exit uh, through the body. So it will give radiation throughout its course of traveling. So the tumor will get that dose of radiation, but along with tumor, the area which is coming in between will also get some kind of dose. With use of modern techniques like IMRT, IRT, VMAT, rapid arc, this dose to the normal structures is kept within normal limits, but still there will be some kind of dose to the surrounding normal structures. The benefit of using proton beam is that the property of proton beam is that it has a Bragg peak. So this is a kind of physics terminology. Today's talk is little bit of technical, and some people might not understand all the things regarding these terminologies. But don't worry, if you understand, it is good. If you are not understanding, then also don't worry. In summary, I will tell you which patients has to undergo proton beam therapy and which patients can be treated with linear accelerator or cobalt machine therapy. So the Bragg peak, the concept of Bragg peak means when proton beam enters our body, it does not give radiation throughout its path of the traveling. So it will give radiation when it ends. So just like you might have seen the crackers in the Diwali, the cracker which we light in the ground and it will go in the sky and it will burst. So just like that, the beam of radiation proton will go enter the body, and it won't give radiation in its course of journey, but it will give radiation at its end, and it does not have exit beam. So the radiation is deposited at particular depth, and in between the radiation is not given. So that is the basic concept. I will just share a PPT with you, and thereby I will try to explain you how. So this is a famous graph in radiation therapy. So suppose this is the depth of depth from skin. Zero is skin, and this is depth, and this is a dose of a radiation. So in case of machines with cobalt machine or X-ray machine, which is a LINAC machine, if we see at skin level there is less dose. At particular depth, the dose will have maximum dose, and after that the dose will slowly gradually decrease. While in case of proton beam, suppose this is a red line, you can see there is very less dose or zero dose uh, up to particular depth, and at particular depth when it according to the energy of the proton, the dose will be maximum, and again once it achieves maximum dose, it will again sharply reduce to zero dose. This thing is called as Bragg peak. So by taking the advantage of this Bragg peak effect, we can achieve a particular dose at a particular depth. So that is advantage of using a proton beam. So hope you understand, and if you are not understanding these technical things, don't worry. So I'll just show you how the proton beams looks. So this is proton beam machine. It typically looks like this. So proton beam is radiation therapy with use of advanced form of radiation, which uses proton as a beam of target cells to kill target cells. So what type of cancers can be treated with use of proton beam? So there are not all cancer patients need to undergo proton beam therapy. There are only specific indications in which we should use proton beam therapy. The problem with proton beam therapy is that the treatment is very costly, because the infrastructure required for use of for proton beam therapy is very huge. So the cost of treatment is very high, and second thing is that availability of proton beam is not there everywhere. In India, only one or two centers are having proton beam therapy. So these are the problems with proton. Second thing is that not all patients need proton beam therapy. 19 more than 99% of the patients can be treated in linear accelerator machine or cobalt machine. So if there is no proton beam therapy machine in your city, don't worry. All patients don't need proton beam therapy. Only a few selected patients, which are highly selected, need proton beam therapy. So linear accelerator machine or LINAC machine is capable of giving radiation to most of the cancer patients, and very few patients need proton beam therapy. So which patients need proton beam therapy? So proton beam therapy can be given in few patients, like brain tumor patients who are treated second time or third time. The tumors which are located in very critical area, and there are critical surrounding normal tissues. In that places also we can use proton beam therapy, just like base of skull lesions or recurrent tumors, or tumors which are located near to the spinal cord. So in that cases, we can use proton beam therapy. Some cases of lung cancer, liver tumors, we can treat with proton beam. So patient of proton beam should be selected cautiously, and not all patients need proton beam therapy. So what are different side effects of proton beam therapy? The side effects of proton beam therapy depends on the site of treatment of radiation. So side effect depends on the site where we are giving radiation. So if we are giving radiation to the head and neck area, patient will have side effects associated with the head and neck. If we are giving radiation to the thorax area, patient will have side effects associated to the organs in the thorax. I have a separate video regarding the side effects of radiation. I will give link of the that video. So it depends on the area of treatment and surrounding normal structures which are there. So how long does this treatment, proton beam therapy, will last? So it depends on the disease site, the stage of disease. If any patient is having cancer and if you are searching for proton beam therapy, how you can decide whether to go for a proton beam therapy or not? You can just consult your radiation oncology doctor. As I previously told you, not every patient needs proton beam therapy. There are only selected patients who need proton beam therapy. More than 99% of patients can be treated in linear accelerator machine or cobalt machine. So you have to talk with your radiation oncology doctor. If you have any doubt regarding cancer radiation therapy, you can consult me online. I will give a link for online consultation in the description, or otherwise you can come to my clinic in Pune and you can consult me regarding radiation therapy. You can also buy my book, Stop Worrying and Start Understanding Cancer. I will give link for the book. It is available on the Amazon and Flipkart. So thank you very much. If you have any doubt, please do contact me for more information regarding cancer. Thank you.